Hi guys, my name is Cassandra Mora, and today I'm going to be talking to you guys about cultural bound syndromes versus universal syndromes related to mental health. To provide you with all this information, I have been using the Cultural Psychology 3rd edition textbooks. So we're first going to be talking about cultural bound syndromes. A cultural bound syndrome appears to be influenced greatly by cultural factors. An example of cultural bound syndrome is eating disorders. This is most common usually in North America, mostly in college students. An example of eating disorder are bulimia nervosa, which is when a person binge eats and then proceeds to vomit, mostly common in female university students. Another example of an eating disorder is anorexia. This is when a person refuses to maintain normal body weight. This is also mostly common in females. Bulimia and anorexia have fewer documented cases in Africa, while they have higher documented cases in Mid-East and Southern Asia. We're now going to proceed to be talking about more cultural bound syndrome examples. The first one we're going to talk about is coral. The definition of coral is basically when a person thinks that he or she's genitals are being sucked up into their body. This is mostly common in East Asia, mostly in China, and mostly common in men. Another example that we're going to be talking about is amok. Amok is when a person has extreme aggression towards certain object or person. This is also mostly common in men and is most common in South Asia, mostly in Malaysia. Now we're going to proceed to talk about universal syndromes. Universal syndrome focuses on biological foundation of mental illnesses. An example of a universal syndrome would be depression, which is mostly commonly identified in Western and Northern America. Physicians that usually try to diagnose depression use the DSM-5, which consists of a list of 9 symptoms that a person with depression may or may not have. Depression is less commonly diagnosed in some cultures. An example of a culture that is less commonly to diagnose depression would be China. Nigeria, on the other hand, has a higher rate of depression than the United States of America. Now we're going to be talking about other universal syndromes such as social anxiety disorder, which happens all around the world, mostly profound in East Asia than in Western Asia. Usually Asian Americans report higher chances of having it than European Americans. Another example of universal syndrome that we're going to be talking about is schizophrenia. Schizophrenia is known of having a biological foundation, meaning that it is passed down through your genes. There are 2 types of schizophrenias that are known throughout culture, paranoia and catatonic. Usually, according to the textbooks, people that are lower class have higher tendency of getting schizophrenia than people that are in middle or higher class.